Vitamin D.
Vitamin D is both a nutrient we eat and a hormone our bodies make. It is a fat-soluble vitamin that has long been known to help the body absorb and retain calcium and phosphorus. Both are critical for building bone. Also, laboratory studies show that vitamin D can reduce cancer cell growth, help control infections, and reduce inflammation. Many of the body's organs and tissues have receptors for vitamin D, which suggest important roles beyond bone health, and scientists are actively investigating other possible functions. Vitamin D supplements are available in two forms: vitamin D2, ergocalciferol, or pre-vitamin D, and vitamin D3, cholecalciferol. Both are also naturally occurring forms that are produced in the presence of the sun's ultraviolet B, UVB, rays, hence its nickname, the sunshine vitamin, but D2 is produced in plants and fungi and D3 in animals, including humans. Vitamin D production in the skin is the primary natural source of vitamin D, but many people have insufficient levels because they live in places where sunlight is limited in winter, or because they have limited sun exposure due to being inside much of the time. Also, people with darker skin tend to have lower blood levels of vitamin D because the pigment melanin acts like a shade, reducing production of vitamin D and also reducing damaging effects of sunlight on skin, including skin cancer. Recommended amount. The recommended dietary allowance for vitamin D provides the daily amount needed to maintain healthy bones and normal calcium metabolism in healthy people. It assumes minimal sun exposure. RDA. The recommended dietary allowance for adults 19 years and older is 600 IU daily for men and women, and for adults GT, 70 years it is 800 IU daily. The tolerable upper intake level is the maximum daily intake unlikely to cause harmful effects on health. The for vitamin D for adults and children ages 9+ is 4000 IU. Health. Learn more about the research on vitamin D and specific health conditions and diseases. Bone health and muscle strength. Several studies link low vitamin D blood levels with an increased risk of fractures in older adults, and they suggest that vitamin D supplementation may prevent such fractures, as long as it is taken in a high enough dose. Heart disease. The heart is basically a large muscle, and like skeletal muscle, it has receptors for vitamin D. Immune and inflammatory cells that play a role in cardiovascular disease conditions like atherosclerosis are regulated by vitamin D. The vitamin also helps to keep arteries flexible and relaxed, which in turn helps to control high blood pressure. Type 2 diabetes. Vitamin D deficiency may negatively affect the biochemical pathways that led to the development of type 2 diabetes, including impairment of beta cell function in the pancreas, insulin resistance, and inflammation. Prospective observational studies have shown that higher vitamin D blood levels are associated with lower rates of type 2 diabetes. Risk of premature death. A promising report in the Archives of Internal Medicine suggests that taking vitamin D supplements may reduce overall mortality rates. Food sources. Few foods are naturally rich in vitamin D3. The best sources are the flesh of fatty fish and fish liver oils. Smaller amounts are found in egg yolks, cheese, and beef liver. Certain mushrooms contain some vitamin D2. In addition, some commercially sold mushrooms contain higher amounts of D2 due to intentionally being exposed to high amounts of ultraviolet light. Many foods and supplements are fortified with vitamin D like dairy products and cereals. Cod liver oil, salmon, swordfish, tuna fish, orange juice fortified with vitamin D. Dairy and plant milks fortified with vitamin D. Sardines, beef liver, egg yolk, fortified cereals. Ultraviolet light. Vitamin D3 can be formed when a chemical reaction occurs in human skin, when a steroid called 7-dehydrocholesterol is broken down by the sun's UVB light or so-called tanning rays. The amount of the vitamin absorbed can vary widely. The following are conditions that decrease exposure to UVB light and therefore lessen vitamin D absorption. Use of sunscreen. Correctly applied sunscreen can reduce vitamin D absorption by more than 90%. Wearing full clothing that covers the skin. Older ages when there is a decrease in 7-dehydrocholesterol levels and changes in skin, and a population that is likely to spend more time indoors. Certain seasons and living in northern latitudes above the equator where UVB light is weaker. In the northern hemisphere, people can't make enough vitamin D from the sun for 4, 5, and 6 months out of the year, respectively. In the Southern Hemisphere, residents of Buenos Aires, Argentina, and Cape Town, South Africa, make far less vitamin D from the sun during their winter months, June through August, than they can during their spring and summer months. The body stores vitamin D from summer sun exposure, but it must last for many months. By late winter, many people in these higher latitude locales are deficient. Note that because ultraviolet rays can cause skin cancer, it is important to avoid excessive sun exposure and in general, tanning beds should not be used. Signs of deficiency and toxicity. Vitamin D deficiency may occur from a lack in the diet, poor absorption, or having a metabolic need for higher amounts. If one is not eating enough vitamin D and does not receive enough ultraviolet sun exposure over an extended period, a deficiency may arise. People who cannot tolerate or do not eat milk, eggs, and fish, such as those with a lactose intolerance or who follow a vegan diet, are at higher risk for a deficiency. Other people at high risk of vitamin D deficiency include people with inflammatory bowel disease, ulcerative colitis, Crohn's disease, or other conditions that disrupt the normal digestion of fat. Vitamin D is a fat-soluble vitamin that depends on the gut's ability to absorb dietary fat. People who are obese tend to have lower blood vitamin D levels. Vitamin D accumulates in excess fat tissues but is not easily available for use by the body when needed. Higher doses of vitamin D supplementation may be needed to achieve a desirable blood level. Conversely, blood levels of vitamin D rise when obese people lose weight. People who have undergone gastric bypass surgery, which typically removes the upper part of the small intestine where vitamin D is absorbed. Conditions resulting from prolonged vitamin D deficiency. Rickets, a condition in infants and children of soft bones and skeletal deformities caused by failure of bone tissue to harden. Osteomalacia, a condition in adults of weak and softened bones that can be reversed with supplementation. This is different than osteoporosis, in which the bones are porous and brittle and the condition is irreversible. Vitamin D toxicity most often occurs from taking supplements. The low amounts of the vitamin found in food are unlikely to reach a toxic level, and a high amount of sun exposure does not lead to toxicity because excess heat on the skin prevents D3 from forming. It is advised to not take daily vitamin D supplements containing more than 4,000 IU unless monitored under the supervision of your doctor. Symptoms of toxicity: anorexia, weight loss, irregular heartbeat, hardening of blood vessels and tissues due to increased blood levels of calcium, potentially leading to damage of the heart and kidneys. Did you know? Catching the sun's rays in a sunny office or driving in a car unfortunately won't help to obtain vitamin D as window glass completely blocks UVB ultraviolet light. Thank you for watching. Press that subscribe button and hit the notification bell to keep updated with new content.